It's my privilege to introduce our keynote speaker, Dr. Laura Magaña. She's president and CEO of the Association of Schools and Programs of Public Health. She's also the founding president of the Global Network for Academic Public Health, which is an alliance of 7 regional associations representing schools and programs of public health worldwide. So Dr. Magaña has, again, quite an interesting and diverse portfolio of prior experiences. She's run public and private universities, she's run NGOs, she's run international organizations, UN programs, you name it. Most recently, she was Dean of the School of Public Health at the National Institute of Public Health in Mexico. During her time as CEO of ASPPH, she's really focused her efforts on strengthening academic public health research, really trying to enhance the voice of academic public health through advocacy. She has a recent initiative called Vision 2030, which is an exciting opportunity to address some of the critical issues in public health. This has 5 sort of strategic pillars, if you will: dismantling racism in academic public health, climate change in health, framing the future, 2030, gun violence prevention, and the ASPPH Workforce Development Center. I think we're only allowed to work on one of those at this point. But we're very excited to have Dr. Magaña here with us, and I really want to thank Tim Leshin as well. To have these 2 people with us for the day has really been a privilege for us, and I think a tremendous learning opportunity for all of us, and hopefully the start of future collaborations as well. So, Dr. Magaña, please.
Thank you so much. Well, it's my pleasure to be here. This is the first time that I'm here in the Yale School of Public Health, so I'm really honored because all of you have been really engaged with ASPPH, and of course, your dean. It's very, very engaged with us. She has been an incredible voice and representation of your faculty here, your students. So I really am thanking really Dean Megan Roney, as well as, of course, Michael Skoneski and all the team that have make this possible, this symposium. I have already learned so much this morning, so it's really my great pleasure to be here, of course, with Tim as well. So let's start. My talk is about global collaboration. We have been talking a lot during all this morning about this, and of course I'm going to be reinforcing maybe some of the topics, some of the issues that you have already raised this morning, and go deeply on those. So, as a new U.S. administration really sets its agenda, our nation stands up as a pivotal moment for public health and for global health. Decades of progress in reducing health inequities, advancing civil rights, combating infectious diseases, and promoting scientific innovation now face uncertainty. Political polarization, misinformation, and sweeping policy changes have created an atmosphere of concern, with many fearing that our hard-earned gains in building a healthier communities may be stalled or even reversed. However, within this uncertainty lies an extraordinary opportunity. So public health is built on resilience, adaptability, and hope. This moment calls for us to highlight the vital contributions of public health professionals, reinforce the importance of prevention, and recommit to the principles of equity and collaboration, which we have been talking all this morning. Public health is more than a response to crisis. It is the foundation of thriving communities, sustained progress, and a healthier world. The challenges before us, although very real, present an opportunity to reinforce the essential role of public health professionals and amplify their contributions to society. This workforce has operated behind the scenes for too long, preventing diseases, improving health outcomes, and ensuring community well-being. So public health professionals are the unsung heroes of our daily lives, working tirelessly to keep us safe and healthy. Public health successes often go unnoticed until a crisis, of course, such as a pandemic or natural disaster occurs. So we must change this perception. Now more than ever, we need to highlight their work, making the invisible visible. so that the public fully recognizes their invaluable contributions. Only then can public health be established as a bipartisan, long-term investment rather than a reactionary service in times of crisis. A critical part of this effort is storytelling. By sharing the proactive, behind-the-scenes work of public health professionals, we can shift public health perception. We all know that their impact extends far beyond crisis responses, but the public may not realize that. So we must consistently communicate these success stories through media engagement, social platforms, and community partnerships. Clear, relatable messaging, countering misinformation, and fostering trust are essential to reshaping public health's role in society. So we have work to do. This will not change overnight. It requires intentionality, strategy, and a change of narrative. So it's urgent that we act on this. ASPPH is right now launching this particular project, and we want all of you to be engaged. We need to really inform the public about what we do. So the audience here knows well that in today's globally connected world, the health of one nation is inextricably linked to the health of all. Localized health crises can quickly escalate into really global emergencies, destabilizing economies, disrupting daily life, and claiming lives on a massive scale. The COVID-19 pandemic demonstrated how a virus originated in one city could bring the world to a standstill in mere weeks. Yet, pandemics are just one of many global health challenges. Climate change is an increasingly threat, intensifying natural disasters, jeopardizing food and water supplies, and expanding the reach of vector-borne diseases like malaria and dengue fever. So these effects disproportionately, and we all know that, impact communities early facing poverty, food insecurity, limited healthcare infrastructure, exacerbating existing inequalities. Chronic diseases further compound these challenges. So in the United States, obesity rates continue to rise, driving an increase in diabetes, cardiovascular disease, and cancer. The CDC reports that over 40% of American adults are obese, with even higher rates in low-income and rural communities. Addressing these challenges requires coordinated, cross-sector collaboration involving governments, healthcare providers, educators, and businessmen and people. No single nation can tackle these issues alone. The interconnected nature of global health demands cooperation, sharing data, expertise, and resources to ensure everyone has the opportunity to lead a healthy life. So even though we all know this, our systems are still so vulnerable and depending on political will that everything can be jeopardized from one day to the other. So again, the current situation calls for an emergency to change the narrative of global health to one that emphasizes security and economic perspectives while our community moves from the ethics, values, and equity frameworks. We need to do a better job in listening and understanding other perspectives, points of view, and positions. And instead of reiterating our own positions without making any progress, we should apply health diplomacy competencies, including listening skills, compromising, negotiating, changing our narrative in order to move us all along, not as the opposition, but as human beings that care for our health and safety. So for decades, the US has played a leadership role in global health, advancing scientific research, funding international health programs, and responding to global health threats. From the eradication of smallpox to the fight against HIV/AIDS through PEPFAR, the US has demonstrated the transformative power of coordinated evidence-based action. Key institutions like the CDC and NIH have set global standards for public health initiatives, workforce development, and disease prevention. Programs such as Epidemic Intelligence Service and the Field Epidemiology Training Programs have strengthened health systems worldwide. Continued US engagement with the WHO is crucial, we all know that, for global health security. The WHO is pivotal in coordinating emergency responses, advancing health equity, and establishing evidence-based guidelines. Withdrawing from such partnerships weakens our ability to respond to emerging threats and diminish U.S. leadership on the global stage. Additionally, cuts to international aid programs will have devastating consequences we are already facing, particularly in low and middle-income countries. Halting USAID initiatives has already disrupted HIV treatments, vaccine trials, and food aid programs, leaving vulnerable populations in crisis already. Even if funding is partially reinstated, the long-term damage could be irreversible. ASPPH is taking a stand through our advocacy initiatives in raising our voices on all of these issues. We have encouraged the US to remain and to come back as a member of the WHO, and our partners in Europe, Africa, and around the world have joined this call. We decried the removal of critical data sets from government websites, some of which have now been restored, or at least partially restored. We took legal action against the government to protect critical funds that support research capacity at universities engaged in producing the evidence we need to drive public health initiatives. While we continue to advocate for all of this as a nation, we must continue our global work, finding new opportunities and new actors. Some global scholars have said that this is the opportunity to reimagine the global health framework. On one that relies more on developing local capacities, as we were talking this morning, and local leadership and decision-making, bringing non-traditional funders like industry, the private sector, foundations, and other governments to the table, so we do not depend heavily on one single source. At ASPPH, we recognize that the future of public health depends on collaboration, education, and innovation. 4 years ago, we founded the Global Network for Academic Public Health, an alliance of 7 regional associations with a vision of enhancing academic public health worldwide through mutual learning and collaboration. The GNEF, as we call it, unites over 500 academic institutions across 6 continents, creating a platform for shared learning, research, and advocacy, and advancing our collective agenda. So these collaborations drive progress and showcase the power of collective action. I really encourage all of you to join us in this effort, because ASPPH is one of these organizations. All the organizations that exist in the world, which are these 7, are here in the network. So if your network of faculty that you were talking this morning, very impressive about all the work that you're doing, we can amplify that work through the GNEF, because right here, all the schools of public health around the world join us in this effort. And we are working right now because the only part of the world that doesn't have an association of schools of public health is the MENA region, which is the Middle East and the North African countries. So, and we're working right now in order to assist them and collaborate with them so they can organize themselves and having the Association of Schools of Public Health there. But the rest of the world is really united in this incredible platform. One of the most valuable benefits that we see in GNEF is the ability to share data and expertise. So this morning you were saying, yes, some of the data, we have lost as a country the possibility of sharing data. One of the things that we're doing in the global network is actually sharing the data that we can, the one that we have available in all of our regions in order to really keep on moving our agenda. So the COVID-19 pandemic proved that rapid knowledge exchange can save lives, accelerating vaccine development and enabling more effective responses worldwide. So we know that data sharing and lessons learned fuel long-term progress beyond crisis. So in public health, we have incredible successful stories that support this statement. Insights from malaria control efforts in Africa have informed strategies for combating other vector-borne diseases. And tobacco control policies in Australia have influenced global smoking reduction strategies around the world. So these examples highlight the power of collective intelligence in addressing public health challenges. So we will continue to do this in all of our platforms. The future of public health depends on equipping the next generation with the skills, knowledge, and global perspective needed to address emerging challenges. So ASPPH and, of course, the Global Network GNF foster this development through global initiatives, research collaborations, and international partnerships. The GNF has launched initiatives that we want to invite all of you to join, because you're doing a great job here internally, and actually one of the questions this morning was, what else are you doing in terms of just collaboration with other national or international? We can help with that. That's why you're a very important part of our association. Already within our association, there are 158 schools and programs where you already can connect with all of them. And we are in eight countries. So that's one thing that I really want to stress, the importance that ASPPH really cares about the global health. We have been stressing this from within ASPPH, and we open the door for international members to become part of ASPPH. Remember that in order to be part of ASPPH, you have to be accredited. And that's kind of a barrier, right, for many of schools around the world. So, but that's why the ones who really want to be accredited in the States, of course, the door is open, and now we have in 8 countries schools and programs. But for the other ones, we have the GNF, where we have the other network when we can collect and collaborate with faculty, with students around the world, and you can really connect with all of them through GNF. So one of our priorities, and I'm so happy to hear that this morning you have this strong network of faculty. We also believe that that's a way to go. One of our priorities, it is faculty development. So one of our priorities is to strengthen that public health faculty worldwide with a platform for networking and professional development. So we have initiated an online community, and we invite your network to be part of that. And also we have a faculty development program that we're going to start actually launching this fall, in particular in climate change and health, to integrate climate change content into everyday curricula in all our programs. So this training will be conducted with our partners, the Global Consortium on Climate and Health Education, led by Columbia University. This training will start in September, and we invite all of you to join this initiative and be part of a global network of faculty from the schools and programs of public health around the world. We talk also about public health diplomacy. This has been identified as another of our priorities. Our global working group is designing competencies right now and training materials to equip our students with conflict resolution, negotiation techniques, and strategies to strengthen multilateral and bilateral relationships in an ever-changing, polarized world. We heard this morning with Dr. Tedros how difficult it is right now these days for WHO or any other multilateral organization to reach consensus. I just want to give you this example that it really struck me as really the need to really support more the health diplomacy issue. Because years ago, WHO and others reached consensus kind of easily, all the resolutions or the agreements may went through consensus resolution. But lately, like in the last 5 or 8 years, every time they have an agreement or something, they either voted and they only barely reach majority, or they just are stuck, like the pandemic agreement that we're stuck for so many years because they just don't agree on different things. So more and more we need to be aware that all these competencies, we need to have it on our field. We need to have negotiations to how to communicate with others, how to work with others, how to reach consensus, how to really listen and adapt to our own narrative. So we're very proud of this program that we just started, and we will continue our work. So if any of you are interested in joining our task force in health diplomacy, please do so. We need all of you to join all these initiatives. Another one that talks with students, and I'm so happy that this morning you also talk about how do you engage your students. So one initiative targeted at students and young professionals as well is a Riegelman TIPH Global Grant. which allows the students to engage in real-world problem solving, cultivating critical competencies and systems thinking. So these experiences prepare graduates to lead efforts addressing health disparities, climate change, and the future pandemics while they are part of a global network of students and young professionals. How this works is that we have right now 3 cohorts. Actually, this year we're about to open the next cohort. So people around the world, usually students and young professionals, join and then apply for these grants. There is just small money, just seed money for whatever the project they are doing in the community. So we gather more than 20, maybe 30 applications, and usually we select around 15 from around the world. But the most important thing is that, yeah, they have this money and they go ahead and they do their project, but most importantly, they now are part of this network, an amazing network of students and young professionals around the world. Now we have maybe 80 students in that network that now they are sharing knowledge, they are sharing their projects, they are sharing a lot of the experiences. So we really think that through the young professionals and students can also be sharing in this global arena. We are also working with WHO, and we will continue our work with them in the workforce roadmap arena or space. This work started like 3 years ago, and so we have a task force from around the globe, and we developed these and others tools that you can find them on our webpage, but also in WHO webpage. And it is a roadmap and competency-based education framework to the public health workforce. So this is targeted to the ones who are already in service. And of course, we know that they need to uplift all their skills, their competencies. So we know that right now, more than ever, it's not enough to actually come to the university and have your graduate school program in, let's say, 2, 3, or 4 years, or the number of years you stay in the university. But now more than ever, you have to come back to the university, and the university have to go back to the school, to the work, in order to upgrade all the skills and the competencies that the workforce they need to have, all along all their careers. We all know better that now we are really improving the number of years that we are going to be living, and that we know, and the scholars said that the people who actually are born right now are going to be living 90 or 100 years if they're lucky and they live in a developed country. And if that's true, that means that we're going to stay in, working maybe 75 years, right? And if that's true, then there are people that are already talking about the 60-year curriculum, meaning that we need to stay connected somehow to education for like 60 years, 60 decades. So 6 decades, 60 years. So if we think about that, I think that all the universities are also right now trying to reassess their educational offerings. How do they need to reimagine education systems so we can really support our students and alumni throughout their career? So 2 years, 3 years, 4 years would not be enough for really having the competencies that this world needs, and the rapid, changes of everything that's happening is just so rapid, it's just so diverse. Also, the other important fact here is that our alumni are going to be changing so much their careers. There are so many jobs that we cannot even imagine. They have not even existed. They are not existed right now. They're changing. The scholars are saying that our graduates right now are going to be changing 12 times their careers or their positions in a very different and unknown career. So can you imagine if that's going to be the reality, we're going to be really coming back to school, or the school has to join us in our work during the rest of our lives. So to conclude, to have really a conversation with all of you, the urgency of this moment cannot be overstated. The challenges we face demand bold, timely, and coordinated action. We must reaffirm our commitment to the values that underpin public and global health. The stakes are too high to stay as observers and don't be at the table. Public health is not defined by a single moment or administration. We are here for the long run, to ensure a sustained effort to build resilient, thriving communities where health is a right and not a privilege. By strengthening partnerships, fostering trust, and empowering future leaders, we can ensure a brighter, healthier future for generations to come. So let us seize this opportunity to act boldly, to work collaboratively, and change our narrative. I cannot emphasize how important is this for us right now. We need to continue to advocate, of course, for investment for a healthier, more equitable world, but together we can raise to the challenge and create a legacy of progress that transcends borders and benefits everyone, everywhere. So as we close, I would like just to comment in some insights, some recommendations, some just take away ideas. Number one, we need to focus on our mission. So we are in a marathon, not in a sprint. Because our students and our grads right now, as all of us are maybe freaking out, right? But we need to realize that we are here for our mission. And the mission transcends the current moment. So let's remind every single day why I'm doing this here, why I'm here, what's my mission. And that will give us the energy just to continue. Number two, I would say, don't get distracted by the noise. There's a lot of noise right now in the atmosphere, right? It's easy to get distracted with that noise. So the ride we know is bumpy and it's turbulent, but it's just the ride. We're here for a mission, not for our immediate needs. Number three, we need to keep on finding common ground, because also it's easy to just jump in the things that we know it's unfair, they're the things that we are really disappointed on. But also, it's extremely important that public health finds common ground. And let's hear. In order for that to happen, we need to hear the other. We need to be able to really understand the other's point of view in order to really listen empathetic and reach to common grounds. And number four, I would say align as necessary. So I don't know how many of you have heard the aviation rule 160, which I really like to refer to. The pilots know that if they just deviate just one single grade from what they are from the path, every 60 miles they're going to be out the mission for 1 mile. So I want you to think about if one airplane goes from Washington, D.C. to Oregon, and they start, because of turbulence, because the conditions in the air, because many things happen, of course, to aviation, they start to deviate a little bit, and they are not able to go back to the path. They will arrive to Oregon 60 miles off the airport. And you said, but it was just one single, at the beginning, yeah. But the more you walk, the distance and the time make it bigger and bigger and bigger and bigger. And I just want that doesn't happen to public health. We need to return to our path. So let's just hear what's going on, but let's don't miss our mission. Let's don't get distracted there's a lot of noise right now, but we need to start aligning for our mission. And maybe in order to do that, we need to reimagine. We need to change. Also, the others need to change, but we need to change first. We need to see what's the different narrative I need to talk to others in order for them to understand what public health is. We need to say, what's our narrative right now in terms of global health? How do we explain it? We talked about this morning. How do we convince others that by withdrawing from WHO or withdrawing for the grants or for the international aid, it's going to hurt us more than ever? Us, not them. It's us. So we need to do a better job in communicating all those things. So alignment means that. Means being really critical about what we have failed as well, recognizing that, and just align to whatever the times are calling us. And of course, to do all of that, we need to be open, innovative, transformative in the way we do things, and reimagining a new era really for global health. So the future of global health is being built as we speak. And you, all of you, are a vital part of it. So I encourage each of you to take an active role in shaping this new framework. Now we have the opportunity to really reimagine our work. So remember, what may seem like a breakdown is often the beginning of a breakthrough. We have important work ahead, and I'm excited to see how each of you contributes to this transformative journey. So thank you very much, and let's have an open conversation. All right. So I'm glad we have some time for some Q&A, and I really would like to encourage all of you to comment.
So thank you very much, Dr. Magaña. I'm curious to know how ASPPH and organizations like ASPPH can actually help us achieve one of the suggestions that Tim laid out this morning, which is to sort of not just tell your story, but to find ways to tell your story where the audience is big enough for it to actually move the needle. One of the things that sort of individuals can do is identify members of their local community. But is there a mechanism where organizations like yours, which have access to a higher level of media, can try to get people to tell their stories to larger audiences?
Absolutely. And actually, ASPPH could be one of the platforms, because ASPPH has 158 member schools and programs around the country and in 7 other countries, but I also say 8 because the United States is a country. So we are in 8 countries, right? So we do have that breadth. I mean, we work with all of them. So what we want is to amplify what we heard this morning, for example, what you all are doing. But it's important that you also know what Emory is doing and what Kentucky is doing and what Texas is doing, because there may be a lot of ideas if we come together. And we do have different engagement groups at ASPPH. So please contact us, because we can tell you where to go. That we have a lot of engagement opportunities, a lot of governance groups that you can join, and actually some of you are very active members of some of those, and those are the ones who you can come here and they say, I'm doing this, or our school is doing that, what are you doing? And then come together as a group of academic deans, or as a group of data, faculty, or in diversity, or any topic that you're working in all of that. That's like the first level, because that's we're talking about academic public health. But ASPPH also works in a daily basis with our partner organizations, meaning health departments, meaning APHA, meaning the National Institutes of Public Health. So all the others that are also part of the family in public health system. So we are also working on amplifying your work with them as well. The other area is the other health professionals, which we also work with them. But one thing that you just mentioned, and we are starting to do more, all of that are our traditional partners, right? We always think about the family, right? It's like, oh, okay, I'm going to go also for the nurses and with the dog. Yes, and that's perfectly fine, and we need to continue doing that. But how about the churches? How about the markets? How about the non-traditional partners that we need in the community? And all of those people are in the community. That's why we are trying now to initiate this project about storytelling. And the storytelling is going to be about stories in the community, people in the community that goes to the market and goes to the church and goes to the park and goes to the school, the local school, because those are the ones we need to really gather. A couple of days ago, we had actually talking about this project, a very interesting conversation in our office about how do we go and imagine this project. And I loved one of the people reminded us that also other non-traditional actors, I would say, when we talk about social media, for example. So we usually we tend to go to the op-eds, and that's fine. We need to continue doing that. But social media, and in particular, for example, influencers. And sometimes we think about, oh, no, the influencers are for like commercial things. Well, I have been hearing lately that they are used more and more for social causes. So why don't we, engage them in our message, and they will influence especially the young generation and the other publics. So those are the things that we need to do to learn to do more and to do it better. And ASPPH will be it is one of the platforms that can just amplify, because we collect all those ideas from all of you. So it's just, I think it's a way to, I would say, to gather all the information that you have, all the experiences that you have, and just to amplify them. So we will be more than happy to share with all of you all of these engagement groups and task forces that we have in order for you to start engaging with other faculty. And of course, GNF. And now that I'm saying that, GNF you have a very strong network, faculty network. Oh, I'm so happy to hear that, because it will be awesome if you engage with a global network, faculty network, and then you can find other voices around the world that are doing maybe similar work, or you can exchange things. And we're thinking that could be just a platform just to open doors for your students, for your practicum, and for just research initiatives. So those are the kind of things that we just need to do more in these days. So thank you for your question. Any other question or comment? Yes, please. I'm sorry. Yeah.
Could you talk a little bit about that seed grant that you mentioned? I don't know if it was for students and faculty or for others.
Yeah.
Thank you.
Yeah. And it's going to be open very soon, so I can definitely send you the information. But this is seed money to projects that are on site on the communities. For the schools here in ASPPH, we ask that you pair with one school at least outside United States. So, for example, all the programs that you were referring this morning, all of them could be awesome. You can apply for any of those to the seed money and to the seed grants, because all of them are based in Uganda and all these other places. So yes, it's kind of easy to apply. I will send you the information. It's going to be out like in a couple of months, and you can apply for them. It lasts for 2 years. And again, it just gives you the opportunity for the seed money, but more than that, it's just to have the global, network, the cohort that you're part of with people around the world doing work in very different. It's not restricted. It could be any topic of public health, but it has to be just related to the community intervention.
Thank you so much for all these really detailed guidances on how we can navigate the chaos. I really like the one about not getting distracted by the noise. My question goes back to one of your slides on the public health workforce roadmap for natural disasters. Mm-hmm. And I think you hit two really powerful pathways that will remain in effect in this chaos. Workforce and also natural disasters. That's the new packaging for climate. Can you talk more about that roadmap and your programming in each of those spaces?
Absolutely, and I really encourage you to read it. It's a 300-page document. Of course, you're not going to read the whole thing, but our intention, remember, this is a world roadmap, meaning that we were thinking about not just countries like us, but countries around the world that really needed this guidance in terms of, it's a competency-based document, number one. So we looked at all the essential functions of public health in general, and then we came up with, in order to do that, assessment, population health assessment, one of the essential functions, for example. What are the competencies that each country, it's a country-level document, so each country need to have in order to really be good at that, right? So we came up with the competencies. So it's a competency-based document that go very, very deep into the competencies, the tasks, how to teach that, how to evaluate that. So you can actually go to that document and just, if you're interested in just the competencies, if you're interested more about how do they evaluate the competencies, if you're interested in what are the jobs or the titles of people that are going to be doing that. So again, it's a very comprehensive, this is one of the 4 they're so serious. I'm happy to send someone here that you can distribute it, maybe Michael, to all of you, the link to the 4 resources. Again, it is in the WHO Workforce Center documentation area. We have it on our own ASPPH.org, but I can send you the link. Please look at it. I will be more than happy to hear feedback. But that especially is useful for like the health departments. They can look at it and they don't have to start inventing the wheel. They can actually go there and just try to see how those material will be useful to develop, for example, a health department intervention or training for a whole state or a whole smaller health department. But it also helps the universities or the programs where they are working with the health departments in their own states in order to come up with training programs. So for training programs, it's a guide, because it is a guide. Of course, has to be analyzed through what do you need from that guide, how can you adapt that. That's the purpose, it's a framework, but yeah, it has a lot of resources. So that was the intention of it, and it's there, it's being used now and pilot in a very different sites right now in the world. You remind me, another thing that you were, this morning that we're discussing, it was online, the MPH that was presented. I'm very excited about that. Happy to be of any resources to you in terms of the GNF, because remember that GNF is this global organization of academic public health institutions around the world. So maybe if this is in Cambodia, maybe some of the countries around Cambodia can actually also support, help, with any training materials, anything that you need. So if you think that you're doing something in another part of the world, think always about GNF, because that should be your support platform if you need resources, if you need faculty around that area in order maybe to teach some of the courses, or even to develop some of the courses that we're trying to do right now, is just to have also resources online. So, people around faculty or programs around the world can actually access them. That's why we're very enthusiastic about the climate change and health curriculum that we're gonna start in the fall, because a lot of the faculty have said they are not related with climate change. They are, teachers of, faculty in EPI, in bio, and they say, but I really want to really start talking about this in my classes. So how can I know more, and especially how can I embed climate change cases in my EPI class or in my bio class? So that's the purpose of this one. It is for faculty. So if you're faculty and you're interested in getting to the resources that are awesome resources, there are already case studies there, there are already materials to be integrated in your classes, there are assessment tools, there, you name it. So we're gonna start that on the fall. You can apply for that, and hopefully we're gonna have representation from around the world. But then we're gonna have like special classes for regional. So everybody will join like the general course, but then regionally we're gonna have like more like mentoring classes, for you to integrate materials to your courses. And we're just started with climate change, but the idea is that next year we're gonna move to AI, because AI is also an area that faculty, again, is like, oh my God, we need more guidance in this. What can I do? Is this allowed, not allowed? So we are putting together the resources for the AI. Hopefully they're gonna be ready for next year. And next year we're gonna do the same with the topic of AI and technology. How can we embed all these new things in our everyday teaching in public health? So stay tuned, because we're gonna do that, more of that. Okay.
Yeah, thank you. Thank you so much for sharing all of this. I was very curious if you could talk a little bit more about the public health diplomacy one. Is this something for students? And also, as some of us will graduate soon, are we still able to access these resources after graduation? Yeah,
no, absolutely. Right now, because it's kind of a new field that we are kind of starting to put more resources on it, more thinking about it. So the task force, it's a global task force of people, of actually faculty right now. But the task force, actually, we just came together and we developed like the definition, the competencies, and we're moving towards developing tools materials. So once that phase is done, but you're happy, I invite you to be part of that implementation task force, which we're going to be moving very close, very fast to that stage in order to develop the materials that we're going to put on upload in our webpage in order for everyone to use. And I'm sure that once we have the materials, that also we're going to be sharing with the workforce, because as I said before, that's why for us workforce is extremely important, because you're going to be with us just like a couple of years, 3 years, but the workforce is with us like 30 years, 40 years or more, right? So we need to start really seriously developing more tools for the workforce, and everything has to be free and online and accessible for the workforce that needs to be trained. But they're, a reminder, they have a full-time job. Sometimes they have a full-time second job at home with kids or with parents or with husbands and wives. So we need to think about what are the best way to upgrade their skills without being such a heavy lift. So yes, if you want to join us to develop those materials, happy to do it as well, please.
Thank you very much, and thanks for your leadership during this time. I enjoyed your analogy to our story of moving 1 degree and where that can end us, where we can end up. I guess my question is maybe one specific example. There are many such examples. As an Association of Schools of Public Health and how we educate our students, the term DEI has become something that we are scrubbing, yet every one of those words is so central to public health, to global health. How is ASPPH approaching this? It feels very uncomfortable to take those terms away from our education. They're central to everything we do. Yeah. Should we just forge ahead or do we need to bend a little bit and find new ways to do that same thing? It feels counter to our DNA. Just wanted to get your thoughts as a leader in the area.
And I'm going to use the first part of your comment to answer your question. Thank you for your question. For your question, it has been a struggle for ASPPH trying to define what we want to do, but we have found a pathway for that, and it took us a lot of discussions and, of course, consulting with all our members. Remember that we are representing all of our members. So it's like a parent, right? You want to be fair to all your kids, right? I mean, you are representing all of them. So we cannot do anything that will jeopardize one single of our members, because then you will not represent that member in particular. Because we thought a lot about this when we were trying to see what do we do, because at the beginning, of course, we all feel like, no, that's what we do. This is in the essence. So just remember, again, exactly my words at the very last slide when I said, remember your mission, number one. Our mission, of course, is inclusivity. Of course, is health equity. That's what I do, right? But in order to do that, if right now in the midst of everything that's happening, right, and for some people or from some audience, it's just like a no, because you're going to be actually breaking the law. If you do, or if you say so, it's just like you need to, again, align to your mission. My mission is my mission. We will never, give up to the very values of what define our field. But remember, DEI is actually a new term. Can you remember in the 70s, in the 60s, in the 80s? When we started talking about the social determinants of health, that was like, in the 90s. So really we have been doing this. Public health has been here for more than 100 years, and we have been always about health equity, about vulnerable populations. So if right now we need to really use in our vocabulary maybe other words to define our work, that's the new narrative, that's the alignment that we need to do right now for the current moment, because we care about the others, because we care. I don't want any of my members to feel that they cannot go to my meetings anymore because we say DEI, right? We actually, in the DEI section right now, we said, well, okay, what's the purpose of the DEI? And then we said the purpose of DEI is to have excellence education, excellence institution, well, let's call it like that, right? Because that's what we want to. We want to have everyone inclusive and diverse. Well, let's redefine that for now, right? But let's keep on moving our values, our programs, no matter what. So it's more about that mission, and we need to now be concentrated in the long run as opposed to in the immediate run. Thank you for your question, a tough one, actually.
Dr. Magaña, thank you so much for a great presentation, a great conversation with our audience. Really appreciate you being with us today.
Absolutely. Thank you. Thank you.